Our first community conversation, we're joined by Dr. Katie Fetter, a head and neck cancer surgeon with UVA Health. She's sitting down with Aaron.
Dr. Fetter, it's great to have you here today. Thanks for coming in.
Thanks for having me.
You're so welcome. So we wanted to talk about head and neck cancer awareness month. So first of all, what are the major risk factors for head and neck cancer?
So head and neck cancer is what we treat in my practice, and the major risk factors associated with that are tobacco use, that's chewing tobacco and smoking as well, heavy alcohol use, and exposure to factories and certain environmental toxins, as well as HPV or human papillomavirus exposure.
And what are the common symptoms of these cancers?
So there can be quite a few. Some of the most common are a lump in the neck or a swollen lymph node that doesn't go away after a few weeks, 2 weeks usually. You can also have a sore throat or a change in your voice, like hoarseness. Anytime you have a sore in your mouth or a spot that is painful and doesn't go away after a week or two, that's also something that could indicate that you might have an early cancer.
And what about treatments? What treatments are available?
So there's a variety, and it depends on when you catch it and where exactly the cancer is. It is usually a combination of surgery, radiation, and chemotherapy. The earlier you catch a cancer, the fewer of those treatments you have to go through, and the less side effects you can have. And so that's why during Head and Neck Cancer Awareness Month, we really want to focus on getting awareness out for risk factors and signs to look for, because if caught early, then you can minimize all of the treatments that you have to go through.
Right. That's what we want. And then you guys also have a free head and neck cancer screening event coming up pretty soon, right?
We do. So I work in the ENT department at the University of Virginia, and so we actually work with the Charlottesville Free Clinic, and we see patients there once a month, and so they have been very gracious, and they have partnered with us this year to host our head and neck screening, and that is on Saturday, April 19th from 8:30 to noon. And so we're seeing patients as walk-ins, or you can call our clinic to get an appointment. And really the goal there is to just talk about any risk factors that patients might have and go through brief medical history, family history, and then do a basic head and neck physical exam to get an idea if there really is an increased concern. Anyone that has anything that raises a red flag or is a cause for concern, then we would get plugged in with our clinic at the Emily Currett Cancer Center. And
you said anyone can just walk into this event? That's great.
Yeah, so walk-ins are welcome. We also have my assistant Stephanie is taking appointments as well, and I don't know if we'll have her phone number up. It's 434-982-1885, and so you can call, and if there's a time that's convenient, make an appointment as well.
Very nice. And again, that's Saturday the 19th.
Yes.
All right, that is coming up soon, and hopefully it's a good turnout.
I hope so too.
Yeah, thank you so much, Dr. Fetter, for coming in. We appreciated you being here.
I really appreciate it. Thanks so much.
Thank you. All right, Steve, over to you.